So this afternoon, we begin, as usual, with the chairman of the Presidential Task Force, SGF, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, I welcome you to the national briefing by the Presidential Task Force on COVID-19 for Monday, 11th May 2020. Yesterday, Sunday, 10th May 2020, marked the end of the first week in the eased restriction phase. I wish to remind you that we are still in phase one of the three-pronged fortnightly strategy. The completion of the first week has provided the PTF COVID-19 an opportunity for a mid-phase review of the impact of the guidelines put in place to drive our national response. I'm also sure that Nigerians have equally focused on the pandemic and have done their assessment of progress made, especially as it relates to compliance. One gratifying outcome of the assessment we have all undertaken as stakeholders is our convergence of thought on the level of compliance with the guidelines and how our individual and collective response could improve and or jeopardize our ability to contain the coronavirus. During the first week, the country generally witnessed increased number of positive cases. This is attributable to our expanded capacity for testing with the opening up of more testing centers and laboratories. As of today, there are 21 laboratories nationwide, including private laboratories, and we continue to engage with more private laboratories on stream. Similarly, we wish to confirm that states have been encouraged strongly to set up isolation centers, wards, including ICU, with a minimum of 300 beds each. This will help accommodate levels 1 and 2 cases. However, with the increase in numbers, we are beginning to experience some elements of shortages of bed spaces in isolation centers, especially in the high burden areas. We are conscious of the need to take care of different categories of persons, e.g. people living with disabilities, terminal conditions, and other underlying factors, stroke comorbidities. We have also been able to complete the evacuation of 2 batches of Nigerians from the United Arab Emirates and the United States of America, along with another batch from the United Kingdom. We would continue working with our missions overseas and other relevant partners to ensure the evacuation of others with clearly defined rules of engagement. The Presidential Task Force has continued to review the relevant policy and protocols so that our actions and decisions are most effective and the nation can properly take COVID-19 positive cases out of circulation to avoid the spread or continuous spread of the virus. We have recognized a significant role for community ownership, guidance, acceptance, and implementation, and the Presidential Task Force will introduce appropriate inclusive policies in the coming weeks. You will be apprised of developments on this in due course. As part of efforts to support the states in the establishment of isolation and treatment centers. I wish to remind our state governors that the Catholic Bishops' Conference has offered and volunteered all the 425 hospitals and clinics that belong to the Catholic Mission nationwide for adaptation and use as isolation centers. Governors in the various states are encouraged to please approach Catholic archbishops and bishops in their states to access these facilities. As a further cost-effective measure, I also wished to remind some national authorities that the Nigerian Institute of Architects have pledged the pro bono services of their members to modify, design, and supervise all COVID-19 related projects nationwide. Again, we urge that this offer be taken up speedily. The Presidential Task Force has also continued to receive, rather sadly, reports about challenges facing the frontline health workers. They have received threats to lives, experienced detention by patients, they are actually nursing to health, and suffer other forms of harassment. Let me underscore the fact that these frontline workers constantly put their lives on the line to make sure persons infected are provided with the best care possible to enable them become healthy citizens again. It is therefore inhuman and unacceptable that patients engage in acts of locking them up and making demands that these frontline officers, most of the time, do not have the capacity to address. The Presidential Task Force COVID-19 views such behavior as reprehensible and should be deprecated. We call on all state governments to take this up appropriately. On the overall, the Presidential Task Force is identifying and assessing all low to medium and high burden areas with a view to assessing and modifying our strategy. This will involve drilling down from all tiers of government to community level. This mention serves as a notice to traditional and religious and community leaders to brace up for deeper involvement as we develop the protocols to strengthen community ownership in the national response. While we continue to work on all options, the Presidential Task Force wishes to repeat the dangers inherent in the lack of compliance with guidelines issued. We must always remind Nigerians that Mr. President took a painful and difficult decision to ease the restrictions by approving revised measures that will maintain a balance between the safety of Nigerians and giving them the opportunity for some level of economic activities that will sustain their means of livelihood, especially the poor and vulnerable who depend on daily means of subsistence. The eased restrictions must therefore not become an excuse for us to lead the lives we were used to pre-COVID-19 days. I wish to reiterate that the world today has completely changed from what we used to know. And if we want to continue living the old ways, the costs would be enormous. Contracting COVID-19 is not a death sentence, but disregarding the guidelines for its avoidance, as guided by experts, is a costly self-voyage. Unfortunately, such choice cannot be made by individuals, but the collective. And we are all resolute in stamping this scourge out of Nigeria. Tomorrow, we hope to commission the this-day dorm treatment and isolation facility. It will add a total of 270 beds to our capacity in Abuja. This is a private sector-driven initiative, and we commend the efforts of this day and its proprietor, the NNPC, Sahara Energy Group, CCECC, and all the partners involved in this enterprise. Finally, I wish to underscore our appeal to Nigerians to please continue to comply with the guidelines. You must take personal responsibility for actions. I now yield the podium to the Honorable Minister of Health to update you on new developments. Thereafter, the Director General, Nigeria Center for Disease Control, would have the floor, followed by the National Coordinator of the Presidential Task Force. I thank you for listening.